Good evening, everybody. This is Anthony with the Wrench Start Experiment. I thank everyone for tuning in this evening or this afternoon or whenever you watch this video. It is April 23rd. Today, we're going to be discussing some of the Alaskan mandates with the COVID-19 pandemic and much more. So stay tuned. Look into this. The day before the grand reopening of businesses. So this is a very large debate right now between really two groups of people, and it's pretty much everywhere. So we have one group of people that are 100% behind the medical side of things and believe that opening early is a large issue from the medical side. There's a lot of beliefs that the numbers are going to get crazy and all these crazy things are going to happen. And then you've got people that are a little bit below that, little bit below that, little bit below that, and then it goes all the way down. And on this side, we have the economy and the economical disaster that we're in. And it's the same kind of thing, right? So you got people that are like, the pandemic isn't real. Open the economy. You got people that are that think this is the flu, this is this, and this, and then it kind of goes down and down. No, I see value in wearing a mask, but I still want the economy open. And then you've got your guys right in the middle that are like, yes, we need to open the economy, and we need to be safe with doing so. With that being said, tomorrow I feel like it's an approach that addresses kind of both of those sides to a certain degree. So let's start off with today's numbers. So we have 2 new cases as of today. If I remember correctly, one was a child under 10 and the other was a individual in their 60s. We're currently at 337 cases. We have 209 recovered at this time, 36 hospitalizations, and our total deaths at this point are still 9, which, whether you're religious or you're not or what have you, any pandemic, anything that takes life from another human being, they're generally, especially in these cases or senses, there's definitely a moment, whether you know them or don't know them, where you should at least reflect on things. And obviously, if you do know them, the sympathy and support goes to the families. But, it's just hard to see that number. And the rest of it, it's hard to see as well. But that's the number that always kind of slows me down when I'm going through this. All right, so let's jump into some mandates. So obviously, at this point, most of you probably know that tomorrow, April 24th, the governor ultimately met with mayors across the state. Now, I don't know all the guidelines. I'm just going to go off the state page on this stuff because I know that Berkowitz and Anchorage is doing something different than here, than there, and all that. I'm not getting into that today. If you need that information, I highly suggest that you go to your municipality or city website and start following what they're doing, because they're doing a version of what I'm about to go over. But tomorrow, businesses will reopen. We did one mandate that I did not see until today was Health Mandate 17. So let me kind of go into this a little bit. So this was issued April 23rd, or actually was issued today. So that would be why I didn't see yesterday. Let me close my door. The dog came in, so I apologize for that. So this did come in to slow the spread of the coronavirus 2019 or COVID-19. The state of Alaska is issuing its 17th health mandate based on its authority under the Public Health Disaster Emergency Declaration signed by Governor Mike Dunleavy, March 11th, 2020. Given the ongoing concern for new cases of COVID-19 being transmitted via community spread within the state, Governor Dunleavy and the state of Alaska are issuing Mandate 17 to go into effect tomorrow, which is in conjunction with the businesses opening. Will reevaluate May 20th, 2020. The mandate is issued to protect the public health of Alaskans. By issuing this mandate, the governor is establishing consistent mandates across the state in order to mitigate the impact of COVID-19. The goal is to flatten the spread. We know that. The purpose of the mandate, I'm trying to just get down. Okay, let's just get down to the mandate. All right. Mandate 17, protective measures for independent commercial fishing vessels. So let's see, definition for the purpose, independent commercial. Let's see if I can just kind of skim through. The plan is to revise 10 and 12, which we'll go into here in a moment. So apply for skiffs from offshore and other vessels. Let's see, required protection measures. Independent commercial vessels operating in Alaska waters and ports must enact the protective measures for procedures described in Appendix 1, protective plan. Holy cow, compliance with mandate. So this is just like a full review or a semi-review. So there is Appendix 1. I wonder if it's in this. So that was a big thing, was commercial fishing. Sorry about just kind of skimming through this. I thought there was like an actual explanation. So let's dive into Health Mandate 16. That's Reopen Alaska Responsibility Plan Phase 1A. So 1 alpha, folks. Let's see. Essentially, we know that they're doing this within limitations. So I'm going to run through these as quick as I possibly can. I just do want to cover as many as I can, I guess. So let's start with Attachment D. Non-essential public-facing businesses, generally, not including retail. So let's see, social distancing. Okay, so non-essential businesses can resume operations if they meet the following requirements. Okay, you ready? Social distancing. Reservations only. Walk-in prohibited. Fabric face covering must be worn by all employees. No more than 20 customers or 25% maximum building occupancy as required by law, whichever is smaller, is permitted at any one time. Now, that's going to be a key part as we go through all of these, because that is just an interesting thing. So outdoor businesses are not limited to the numbers of customers, but must maintain social distancing. Groups and parties must be limited to household members only. Social distance of at least 6 feet maintained between individuals. Establish a COVID-19 mitigation plan addressing the practices and protocols to staff and the public. Entryway signage must notify the public of the business's COVID-19 mitigation plan and clearly state that any person with symptoms consistent with COVID-19 may not enter the premises. So hygiene protocols, employer must provide hand washing or sanitizer at customer entrance in communal spaces. Frequent hand washing by employees and adequate supply of soap, disinfectant, hand sanitizer, and paper towels are available. Equipment or employer must provide for hourly touch-up sanitation, workstations, equipment, etc. Staffing, employer must provide training for employees regarding the requirements and provide each employee a copy of the business mitigation plan. No employee displaying symptoms of COVID-19 will provide services to customers. Symptomatic or ill employees may not report to work. No employee will report to work to the work site 72 hours of exhibiting fever. Employer must establish a plan for employees getting ill and return to work. The plans to follow CDC guidance. And then it goes on and on for some of the CDC stuff and a little bit of the staffing. So that is, because I don't want to sit here and read each individual, and that's Attachment D. Now, when I looked at this yesterday, I read through this, or last night when this came out. Let me open this back up. I think a lot of this was very similar. So this is retail business. Let's see. This, it just says retail businesses. Retail businesses may resume operation if they meet the following. For the most part, so no more than 20 customers, 25% building occupancy, social distance of at least 6 feet is maintained between non-household individuals. Fabric face covers shall be worn by all employees and patrons. So fabric face covering shall be worn by all employees and patrons. Only one adult per household per visit. Again, they have to have the COVID-19 plan or mitigation plan available to the public in the entrance. And it just needs to be publicly displayed. The rest of it is very similar to the other attachment. So let's go and see. Hold on here. It's loading. Let's go to the next. Restaurants, dine-in services. So this is restaurants may resume table service dining if they meet the following requirements. Social distancing protocol is maintained. Continue to follow all regulatory and state standards, of course. Develop the mitigation plan. Minimize direct contact between employees, customers to increase physical distancing, which obviously in a restaurant, if you're eating out, you've got your cooks, your dishwashers, you've got your front of your house, your hosts and hostesses. And that's an interesting one because the host has to come or waiter has to come to your table. I mean, I don't know how you manage that, at least from the staff, but in retail spaces and everywhere else, generally the staff, you're going to encounter them. So the capacity part here is different though, right? So groups limited to a household members only. So they did open that out of the gate. Limit maximum indoor capacity by 20% based on factors such as square footage, configuration, and fire code capacity. So they're not limited to 20 people. They're limited to 25% of the indoor capacity, which is going to be whatever your fire code is generally. Will be maximum occupancy is set at 80. So giving them 20 people in the store or more, whatever the store is. Outdoors, groups limited to household members only, no more than 20 tables. Table seating, non-household members must be a minimum of 10 feet apart. Reservations only, walk-in prohibited. Groups are limited. Fabric face covering worn by all employees. And then, of course, the entries. Let's see. And then they are saying disposable wares should be used when available as well. Condiments by request in single-use packets. Fully sanitized tables and chairs after each party. Sanitize or provide disposable menus or menu board. Provide sanitizer on each table. And then an hourly touch point sanitation. Hygiene is pretty much your standard hygiene with the COVID stuff added to it. So that is your restaurants and what they look like. Let me keep going here. I'm trying to keep this up for you, so I apologize for the long haul. So personal care services. So it says personal care services. This section applies to your typical personal care services: hair salons, day spas, nail salon, barbershop, tattoo, body piercing, tanning, rolfing, Reiki, lactation consultants, acupuncture. Personal care services can resume if they meet the following. Obviously, you have to fall under all the compliance and board direction. So if your board is saying that this is what we want you to do or that's what you want to do, you've got to comply with that in addition to the mandate. So if there is a COVID difference in these due to the COVID-19, you have to follow those in addition to this mandate. Reservations only, walk-ins prohibited. No person is allowed to stay in waiting areas. Waiting areas should not have any magazines, portfolios, or catalogs. No beverage service can be provided. Only the customer receiving the service may enter the shop, except for a parent or guardian accompanying a minor or guardian or whatever that may be. Someone with disabilities, a friend, relatives cannot enter the business either. Limit of one customer per staff person performing personal care services. No more than 10 people should be in the shop at a time, including staff and clients. Customers must receive pre-visit telephonic consultation to screen for symptoms, consistent with COVID-19. Recent travel exposure to people with suspected cases. No more than 20 customers or 25% maximum building occupancy as required by law. Workstations are 6 feet apart. And then the rest of it, obviously hygiene, you got to stay clean. You got to wear, customers must wear face coverings and sanitize hands upon arrival. Face covering must be worn by customers short-term necessary performing the service. So this one kind of goes on a little bit more in detail of those services provided in sanitation protocol. So I'm not going to touch on that, but this is, again, if this affects you or you know someone that does, that was attachment G on the covid19.alaska.gov website. All right, so the next one in here, to make sure the other dog wasn't trying to get in the door, is attachment H, which is non-essential, non-public facing businesses. This section applies to businesses not interacting with the public and which are not included at attachment A, which is Alaska Essential Services and Critical Infrastructure Order. Fabric face coverings must be worn by all employees. All occupied desks, cubicles, or open workspaces must be at least 6 feet apart. Any high-risk employees must be provided an alternative workspace. Special accommodations to employees are requested to avoid contact to mitigate risk. And then employers must or should make efforts to maximize remote work opportunities for eligible employees. Establish a COVID-19 mitigation plan addressing the practices and protocols to protect staff. Again, just like everyone else, the employer must provide hand washing and sanitizer communal spaces. And then it goes through pretty much the same stuff. If you do feel ill, don't go to work. That pretty much covers that for the bulk of it. Again, you guys need to look into what your city or municipality is doing specifically around these, if this affects you in any way, just so if it's your business, you're safeguarding yourself so nothing happens. There are fines associated with it, which is a slippery slope, at least as far as the communications go. Now, when you read this stuff, like compliance and penalties, I'll read that real quick. So it says vessel captains are required to maintain, that's going back to the fishing. That was the end of the fishing one. But I believe, so the state COVID mandate subject to business organization to order the cease of operation on civil and fine up to $1,000 per violation. And then it's got stuff about like being reckless and there's other fines associated. Additionally, understand a person may be fined $25,000 for Class A misdemeanor. And he goes into stuff like that, recklessly engaging or misconduct and what have you. So, but that's interesting because as the governor talked about it several times, because people bring up enforcing the masks, enforcing the sanitizer, enforcing the social distancing. And his policy pretty much verbatim is Alaskans will take care of Alaskans. And I get that. And holistically, I support that. But again, just like I said earlier, with the two sides and I guess the groups of people that are kind of in each layer of both sides, that is also a part of that same kind of bell curve, to where it's like there's a lot of people that say that that's not going to work, and then there's a lot of people, you've got your rule breakers and you've got your deadly do-rights, and there's a lot of guys in between. So hopefully everybody does everything within their power to work remote if you can. If you are operating a business, take the sanitation protocols. If you're going to be a patron or an individual that has to go to get your hair cut or has to go to Kohl's or Cabela's or what have you, which is understandable. Summer's coming. We get that. But if you have to go to these locations, take a few minutes and make sure you're prepared to do so. Have your face mask. It says it right in there. So there's no reason to sit here and go back and forth on this stuff. Follow by the mandate. Do your part. Even if you don't believe in this, it still is going to prevent you from getting any sickness and prevent you from spreading this as well. So, all right, guys, I know this is a really long video. It was actually long for me. This may be the longest video that I've ever done. I appreciate you if you're watching this to the end, that you stuck it through with me. Once again, it's April 23rd. I'm Anthony. This is the Wrenched Out Experiment. I do once again appreciate everyone that has taken the time to watch these videos, sharing the videos, liking them. All the comments that are coming in are great. And then, of course, if you haven't subscribed, hit the subscribe button, hit the bell too. So if you hit the bell, you will get notified when I do these videos and other videos, of course, as well. All right, folks, I hope you have a wonderful evening and stay safe, and we'll talk to you in the next video.